Baruch has brought an interesting study that looks at what kind of problems and how severe are those problems for pregnant women with pelvic floor dysfunction. And they looked at the different trimesters of a pregnancy. So what they found is there are common problems that women face during a pregnancy with their pelvic floor, and those would be things like a prolapse or a bowel or bladder problem or sexual inactivity. And what they're looking at is how does this change throughout the time frames? They got a total of 300 patients. The least were in the first trimester group, the most were in the third trimester group. And from there, the results they found is 104 of these people had bladder dysfunction, 112 had bowel dysfunction, 130, about half, had sexual inactivity or sexual dysfunction, but prolapse was one of the least reported symptoms. Awareness of prolapse is associated with need to pass urine at night and using pads, but otherwise sexual dysfunction was spread throughout all the three different trimesters. It's important to note these kind of things because this is what the norm is. So when a person is having symptoms outside of the norm, then we should be aware and concerned that something else could be happening.